So good morning once again, everyone. Good morning, Dr. Hariman, ma. Please, can we hear me?
Morning, Doc. I can hear you.
Yes, ma. Good morning, ma.
Morning.
Yeah, we can hear you.
Morning, Dr. Oderino.
Good morning.
All right, I'll start straight away. So, my name is Oladayo Washino. I'm the program manager for the Kunle Hassan Eye Foundation Academy, and I welcome us all to the first edition of the Founder Series for this year with the theme Growing Leaders. Last year, our theme was Leadership and Influence. And subsequently for this year, we'll be having the Founder Series quarterly. So once again, I welcome us all. This morning, we'll be having a speaker that will deliver the topic, developing a career in ophthalmology in a challenging healthcare environment. Before I go on, I would like to go through our house rules. I will encourage all of us to switch off our microphones so that we can hear our speaker. And then the speaker should be the only one having videos on. And then after the section, we would have our interactive session where we'll have the opportunity of asking questions. We can type our questions in the chat box or raise our hands. Any hands raised up, I would call us to ask our questions. But I will also quickly go through our agenda for this morning. Please, can we see my screen?
Yes, we can.
Can see your
Okay,
screen.
all right. Okay, this morning I'll be introducing the speaker, and then we'll have the presentation from the speaker afterwards. And then, like I said earlier, the interactive section will commence after, and then we'll have the opportunity of asking questions. Then our closing remarks. Before then, I would like to speak a little about Eye Foundation Hospital Group and the Kunle Hassan Eye Foundation Academy for those of us that are just joining the Founder Series for the first time, just to familiarize ourselves with the organization. So the Eye Foundation Hospital Group was established in 1993, and its vision is to eliminate avoidable blindness through the provision of equitable, qualitative, quantitative, and affordable eye care to all. The Eye Foundation Hospital is a private establishment and an arm of the organization in Ijebu, which is the Eye Foundation Community Hospital, was established in 2006 as a social enterprise arm of the Eye Foundation Hospital Group to ensure that the poor, the vulnerable, the less privileged in our societies have access to quality eye care. Then the Kunle Hassan Eye Foundation Academy, also known as KHEFA, was formerly known as the Tesseret Community Vision Institute, and it oversees training for our residents, of ophthalmology residents, fellows, the mid-level ophthalmic practitioners, optometrists, and ophthalmic nurses. Then another arm of the Eye Foundation Hospital Group is the Summit Vision Management Company, which is an investment and management company, and which also has subsidiaries in our eye care value chain, which is called the Eye Shop and the Summit Healthcare Pharmaceuticals. Like I said before, in the past, we've had, last year, our theme was Leadership and Influence, and we had a series of lectures on that theme. The lectures were interesting, and definitely the ones we'll be having this year will be equally interesting. Also, I would like to let us know that our previous lectures can be found on YouTube. You can see the lectures held in the past, the Founder Series lectures, on our YouTube channel. So now I'll briefly speak about our speaker for today, who is also our director for research at the Kunle Hassan Eye Foundation Academy. He is Dr. Olufemi Odenrilo, a consultant ophthalmic surgeon and a vitreoretinal specialist. Dr. Olufemi Odenrilo is a past chairman of the Vitreoretinal Society of Nigeria. He qualified as a medical doctor from Obafemi Awolowo University, Ile-Ife in 1993 with a Bachelor of Medicine, Bachelor of Medicine and Bachelor of Surgery. He commenced his residency training as one of the pioneer residents in Eye Foundation Hospital in 1997. During his residency training, he had clinical attachments at Tenet Institute of Ophthalmology in Glasgow, Scotland, Olabisi Onabanjo University Teaching Hospital in Shagamu, Ogun State, and a community ophthalmology posting at Ayo Bello Eye Hospital in Ilorin. He became a fellow of the Royal College of Surgeons of Edinburgh in 2002 and also obtained the diploma in ophthalmology from the Royal College of Ophthalmologists of London in the same year. He is also a fellow of the West African College of Surgeons and has a master's in clinical research from the University of Liverpool. Dr. Odenrilo completed his subspecialty training in vitreoretinal surgery in Eye Foundation Hospital under the tutelage of Dr. Adekunle Hassan in 2004. He is a recipient of the Alpha Alvo Host Researcher Award in the US in 2010 and has had many observatory and clinical attachments in different countries. Currently, he is the medical director of the Eye Foundation Hospital in Ikeja. Dr. Olufemi Odenrilo is proficient in the below-listed retinal and cataract surgeries, phacoemulsification, laser-assisted phacoemulsification, pulse planar vitrectomy, macular hole surgery, routine procedure with inverted flaps or autologous anterior lens capsule, combined phacoemulsification and vitrectomy, combined scleral buccal and vitrectomy, scleral buccal surgery, YAG laser capsulotomy, laser trabeculoplasty stroke SLT, diode laser cyclophotocoagulation, retinal laser photocoagulation, and the likes. His research interest covers laser technology with ophthalmic surgical procedure, OCT angiography for investigating retinal disorders, artificial intelligence in ophthalmology, retinal vein occlusive disorders, improving vision after retinal detachment surgery, ERG for monitoring of retinal disorders, and improving outcomes of macular surgery. Some of the professional significant achievements of Dr. Odenrilo are the presentation of scientific papers in many international conferences, including the Middle East and African Congress of Ophthalmology and World Ophthalmologist Congress. And also he has published in scientific journals. Dr. Odenrilo is the present ophthalmology editor of the African Vision and Eye Health Journal, and he's been a member of the American Academy of Ophthalmology since 2004. Dr. Odenrilo was also a secretary of the Vitreoretinal Society of Nigeria from 2004 to 2014, and has been a member of the Ophthalmological Society of Nigeria since 2002, and presently a founding member of the Vitreoretinal Society of Nigeria. Ladies and gentlemen, welcome with me our speaker for today, presenting the topic, Developing a Career in Ophthalmology in a Challenging Healthcare Environment, Dr. Olufemi Odenrilo. You're welcome, sir.
Thank you, Dr. Pashino. Thank you so much. I think you have to stop the sharing so I can share my slides. I want to appreciate everyone for taking time to spend your busy mornings on Saturday with us today. I want to ask if you can see my slides now. Can you see my slides, please?
Yes, we can, sir.
Okay.
Yes, I can, sir.
Okay, thank you. Thank you for your time. I appreciate the Academy Kunle Hassan Eye Foundation Academy for inviting me. In fact, I'm a member of the House to make this presentation. And interestingly, today's presentation is not an academic, in quotes. I mean, we are not rolling out academic figures. We are just talking generally about developing a career in ophthalmology in a challenging healthcare environment. We cannot overemphasize how challenging our own healthcare environment is. The absence of many things that, I mean, really others get from other climes that we don't get here. First of all, let's look at ophthalmology. Ophthalmology is one of the fastest growing specialties in medicine. In fact, cataract surgery is regarded as one of the most beneficial surgeries in the whole of medicine. A 10 to 15 minute procedure can simply change the life of a person. And when you look at the giant strides that have been made in ophthalmology, lasers in ophthalmology, if you look at the inventions of the 20th and the 21st century, lasers will be one of the major inventions that have changed medicine. The use of lasers in medicine is one of the major things that have changed medicine. And you can see that lasers are used so often in ophthalmology. When I joined ophthalmology in 1997, when we started, there were still a few people doing ICCs, that's intracapsular cataract extraction. And over the years, we all, in fact, almost everyone, I'm not aware of anyone doing an ICC right now. We have all moved to extracapsular, small incision cataract surgery, phacoemulsification, laser phacoemulsification, and the transition has been enormous from having to operate patients and keeping them on admission for a whole week. Today, cases and patients can walk out of the hospital 30 minutes after their surgery with good vision. In fact, some people now don't even pad the eye for a long time after the surgery. They take it off about 2 hours, and the patient can just walk out with a pair of sunglasses. That makes a lot of difference, a lot of changes in just a few decades that I have been introduced to ophthalmology. I remember also the anti-VEGF. A few years back, we had nothing like this, but starting from about 2002, 2003, 2004, we started being introduced to the anti-VEGF. Now, we've gone through a whole series from Macugene to bevacizumab to ranibizumab to aflibercept. Now we're talking of the bispecifics. We're talking of having two places where the faricimab and a number of other things. So it's been a very good ride over the years. Innovations, surgical innovations, from not being able to do much about macular holes to now techniques that give as high as 98 to 99% closure on macular holes. From simple observation that we used to do before, the corneas have become so different. Before, everything was just penetrating keratoplasty, but now there's so many different types of keratoplasties that are being done, and patients are more, they are the ones that benefit most from this. Refractive surgery with lasers, you can keep on saying it over. I mean, looking at all the specialties in ophthalmology, you can see the changes that have happened in just a few decades. Like I said, I've just been around for a little over 2 decades. I'm sure a lot of people have been around for much more than that. So over the years, we've moved from general ophthalmology practice to subspecialty care. Most organizations, most hospitals now focus on subspecialty care. Cornea and refractive, glaucoma, vitreoretinal, pediatrics, strabismus, neuro-ophthalmology, oncology. So subspecialty practice has become the mainstay of ophthalmology practice over the years, and very good for Nigeria too. We have not been generally left behind. But in our own environment, we have our peculiar challenges, manpower challenges, finances, a big skill gap, equipment, issues with our research. You know, in sub-Saharan Africa, sometimes less than 10% of individuals really have the ideal subspecialty training that they would need. Even those that have gone for subspecialty training, they come back, there's a lack of equipment to use, lack of trained personnel to work with. I mean, if you had to go for a subspecialty training in vitreoretina, you allow me to talk a lot about vitreoretina because that's my own subspecialty. And then you come back, you need equipment. You need a vitrectomy machine. If you are doing vitrectomy, at least you need a laser machine for your lasers. You need to have trained personnel to work with you, because only you going for training and having an understanding of the procedure is not enough. The equipment have to be there. They have to be trained personnel that work with you, and this is a big gap in our own environment. Now, this is a map that shows the manpower spread of ophthalmologists worldwide. One thing you will notice on this map is that Africa is missing. This is because Africa has just a few specialists per million of population. So when you look at the whole of sub-Saharan Africa, there's an average of 2.5 per million of population, and it's particularly critical for the Portuguese-speaking countries that have about 1.2 ophthalmologists per million. When you compare it to the English-speaking that have 2.8 and the French-speaking that have 2.2. But overall, with 2.5, we are really not on the map. We are not on the map. We are so low. The number of specialists per million of the population is so low. And this results in a high burden of work and a lower income. I have some friends who just recently had the opportunity to change and then to practice in more developed countries. And one of my friends was saying that she had a clinic and they had to call in to her that, please, will you allow 3 more patients? And that was going to be a total of 15 patients she was going to see on that day. And as soon as the matron left, of course, she said, yes, that's okay. She smiled because she was coming from Nigeria, where, you know, some of her clinics, she was working in one of the high volume centers, and some of the clinics, they could have up to 60 to 70 patients per specialist to see. And either we like it or not, I think we need to be sincere with ourselves. By the time a specialist, an individual, is seeing about 60, 70 patients alone in a clinic, the time to cancel the patient is reduced. The time to do some thorough evaluations is relatively induced. Decisions are made in like a rapid fire. You try to create like a conveyor belt situation where you just see patients transferred. So the personal touch that is expected in many areas in our practice is missing. So manpower is a challenge here. And when we look at these challenges, it's very difficult because you cannot isolate it to only the hospital and to the practice. Like one of my patients said to me one day, he said, "Doctor, why not get new doctors? Get new doctors so that you can, I mean, it's it's not just easy to get a well-trained ophthalmologist. How many training positions are available? And when they are trained, how will they get the equipment to practice? And how good can the training be?" So all these things in an environment where for some time in Nigeria until very recently, there was really no significant budget for eye care. And a lot of the eye care budget was run by NGOs making donations and all these things. And so the development is not as it should be. And the manpower challenges are there. The key statistics in the Nigerian healthcare, you see, one of the major problems I see patients have in dealing with health is finance. Because most of the payments in our economy, especially in Nigeria, it's a little better in some other sub-Saharan African countries, but especially in Nigeria, a lot of the payment is made out of pocket. Just about 3% of the patients of the population have access to health insurance. And it's so mediocre that, I mean, the health insurance we're still having a lot of battle to include in some major disorders that need urgent attention onto the list. But with such a low percentage, it's difficult to get a lot of things on it. We have a very high under 5 mortality rate, a very low life expectancy, very low bed per 10,000 individuals, very low, of course, physicians per 10,000 individuals. And interestingly, we have a population that is skewed towards the below 35. More than 70% of our population is below 35 years. And it's really a challenge, because that means that we are sitting on a keg of gunpowder, because this population gradually grows older, and with the rate of unemployment, so the money is not there for people to spend on their health, and their health is majorly done now out of the pocket. Little available health insurance for. So it's really a challenging environment, and so I just try to share a few of my experience and some things I think we can do as ophthalmologists at whatever level we are, that we can do to develop ourselves and to develop this career and to create room for others coming in. So I think that at this stage in life, we should, we've gone through medical school, we should ask ourselves some general and specific questions about what exactly do we want in life? What gives you fulfillment? Why are you in ophthalmology? What are you good at? I think at this point, for one to be able to develop his career, you first of all have to come to terms with yourself and ask yourself in sincerity what exactly you want in life. And some little things I do to myself sometimes, I try and imagine myself at the age of 70, 80. If God gives grace, more than 80, I try and push my imagination there, and I ask myself, what will I have done in life that at that age I would say to myself, I'm fulfilled? What would I like to be on my table, on my resume, that I have done that will make me fulfilled? I think we all need to do that. I think we also need to ask ourselves more specific questions. That is, what do you want? Do you want to be in academia? I have friends. I have friends who love academics, and they just love to write papers. Some of my friends, he just wants to be a professor. That's just all he wants. That's what gives him satisfaction. He spends most of his time doing all the things that he needs to achieve that. So I think as individuals, we need to ask ourselves those particular questions. Do you prefer to be in a private practice? What do you want to do with your time? Do you want to be someone who organizes and develops strategies for healthcare institutions? All those things are available within ophthalmology. All those things, you could be a strategic person creating, like one of our fellows who was with us for some time, who is presently into strategy in the ministry and is doing excellently well. I feel that these are questions we need to ask ourselves as individuals. Do you prefer to be a surgeon? Prefer using your hands to help patients? You are more. So these are questions that you need to ask yourself, and with the answers will be what will help you to move forward in the profession. So as a result, I created a mission statement for myself. And this is how my mission statement reads: to attain the highest possible level of professional competence in ophthalmology while playing a key role in postgraduate training, mentoring, and research and development of more efficient treatment modalities for the benefit of patients and ultimately humanity. And so this I look back at myself and ask myself if I'm able to achieve this and how far I've gone. And I think we should all do that. This is also not a statement that is permanent, because as time goes on, you see some other areas that you become highly interested in, and you can always add it to your mission statement, and it helps you to be able to focus better and make the right choices as you move. So what are my tips for developing your career in ophthalmology? My first tip will be find a good mentor. You need to realize that the relationship of a mentor and a protege is a mutually beneficial relationship. Many times when people are looking for mentors, they only look for people who will help them, and they don't think about how they will be able to help the mentor too, because mentors also need help. You know, there's this tendency of being I don't know, this is me. I just like to look at, I know some of you might not be watching films the way that I do, but if you watch Gru and his minions, those minions they are a loose cannon. Those minions, they love you when you are doing what they want you to do. The moment you are not doing what they want you to do, in fact, they can become your enemy. You know, they can become your enemy. I'm sure some of you will have seen those yellow annoying minions, and some of them in the films, in the second series, they're actually the ones that turn bad and start attacking. And then when they are good, but they can be bad tomorrow. You can never turn your back on minions. You can never you can never leave them in a place and you are sure they are back there. I mean, that place will be good when you are back, because they destroy it. So that kind of a mentality should not be. We should have a mutually beneficial relationship with our mentors, and communication is key. So find yourself a good mentor. I don't think you can tell me that there's nobody that is doing what you want to do in life. It's quite unlikely. When I did my master's in clinical research, I chose a topic that they found it difficult to find me a mentor, someone to mentor me through my research. Eventually, we found a neurosurgeon who was the closest to the topic and I was taking, and for me it was very beneficial learning from him. So you might not find somebody who is 100% what you want to be, but someone who is close to what you want to be. And it could be in either direction. You could be the one that will find a mentor. The mentor could be the one that will find a protege. And so it's important in developing your career. Occasionally you go back and you talk with your mentor, especially when you're having key decisions to make, when you're having, they see things from a wider point of view. Mostly they've been around, longer than you have been, and they'll be able to help you to take the right decision. So my first advice definitely will be to find a good mentor. Secondly, I would say let's build together. Let's build together. You cannot do it alone. Many times people just want to do it alone. I hear a lot of people who say, well, I'm a self-made man, I did it myself. There's really no self-made man, because even when you were born, it was probably in an hospital. Somebody has that hospital. So there's really no self-made person. We need to build together. We need to build, especially in sub-Saharan Africa, we need to build strong institutions. Now, strong institutions build strong individuals and vice versa. When our institutions are weak, then our individuals will be weak. And when our individuals are weak, our institutions will also be weak. We need to build strong institutions, and strong institutions build strong individuals. Let's work together in developing. If you want to go into private practice, it's good. I always advise people that a group practice is good, because the exposure you get in a good practice is good. You can have your own time to do things. At the same time, if you need to get equipment, if you need to get a number of things, the utilization of the equipment will be better when we work together. Even in government hospitals, when departments work together, it's better. Now, I really haven't had much exposure to working in government institutions, because I just came into a private institution. But I know that even in government institutions, you can really have the build you have together. You can build together. It's so important, especially if you are going into private practice. It's important to go into a group practice. And rather than build yourself, build the institution. It's one of the things that I look back, and when I try to look back, that I believe I will be fulfilled if I see that I've been able to build an institution, something worth it that one leaves behind for the next generation. Let's look at Moorfields. Moorfields is one of the first specifically ophthalmic dedicated hospital in the world, and look at where it is today. Baskin-Palmer, all these institutions we talk about, they've been around for over a century, and it's because people dedicated to building it. And probably, today, if they had been building individuals today, it's very likely that their individual practices will be down. But when we build institutions together, we help each other. And when we help each other, eventually we help ourselves. It's also important to join societies. When you join societies, in your search for mentors, actually, one of the best places you can get mentors is either where you developed or where you did your postgraduate training, or in ophthalmology societies. Those are two places you can get. And within societies, you will have different groups. The young ophthalmologists are there. You have different groups. The subspecialty groups are there. If we all work together and we build these societies become stronger for us, and the societies build the people. The people build the societies, and the societies are now a vehicle that build the people. So it's very important that we learn to work together. It's important that we build strong societies. We have research collaborations. There's really very little that is coming out of research within sub-Saharan Africa, and I know we have much more than that. So number 3 will be focus on developing excellent skill sets. Earlier on in your profession, what is really important is developing excellent skill sets. Now, I'm not saying that having a good earning ability is not a right thing to do. It is. But let your focus be on developing excellent skill sets. Be the best cataract surgeon that you can be. Earlier on in your career, learn to do the best procedures. Sometimes you might have to leave, in fact, most of the time, you might have to leave your comfort zone in order to learn a skill. Earlier on, when I developed interest and I did my subspecialty, many times I would leave, and the way we earn in our group practice, it's what you do that you earn a percentage of it. So what it means is that whenever I leave the practice and I go out, the earnings drop. But despite that, I focused on doing a lot of spending time with my friends in their theater, spending time with people doing a particular procedure I'm interested in. When we go to the different conferences. I spend a lot of time with the technicians. I spend a lot of time with the marketers. They tell you, oh, okay, you know what? If you buy this, this is the advantage for you. If you buy this, this is the advantage for you. If you buy this particular probe, you know that in Africa you reuse probes, but this probe has a sensor. If you buy it, you can only use it once. So if you are going to use it, the best thing for you to do is to bring your patients together. And so those are things that you are going to get from technicians, from marketers, that will help you in your practice. And in your surgery, you have skill sets. Let me also go to emphasize that when you have mentors, you could have mentors and colleagues that you probably finished at about the same time, that you can ask them, oh, this is what I do, what do you do? So those things, they are really very important. And sometimes people put the earning capacity above developing excellent skills. And it's one truth we need to bear in mind, that the older you get, the more difficult it is for you to be able to get to learn new things. So the best thing for you is to learn new things as young as possible. It's not that you can't learn new things the older you get, but it becomes more difficult. So developing your skill is really good for you to do it very early. I mean, this is an experience. I've had a lot of people come in to learn and work with me as fellows in retina, and I can tell you it's one challenge that they have. It's better to learn things earlier on and be ethical. No matter what you do, no matter how good you are, if you do not practice in an ethical manner, you are less likely to grow. You get into a lot of problems. And don't let's forget the 4 basic principles of ethics, medical ethics: autonomy, beneficence, non-maleficence, and justice. Autonomy just means that every patient has the rights to their bodies. The patient can simply, a competent adult can refuse or accept treatments, drugs, and surgeries according to their wishes. I've had patients who in their 10th and 9th decade, and they have cataracts and they have 6/24 vision, and he says to me, just leave me alone. Just leave me alone. I'm just okay with my 6/24. You say, if you do this cataract, you'll see better. No, I'm okay. I've seen enough in this life. Ethically, you leave them alone. I mean, it's interesting that I had a patient who said something like that. And then the family came to me after he had left and said, you know what we can do? Let us put Papa to sleep. Let us put him to sleep and just do the cataract surgery. That's what we will do. We won't tell him when he's coming to the hospital that he's coming in for a surgery. And I told them, no, this man he's clear, he's competent, he doesn't have dementia, he's okay, and he has categorically said he doesn't want any surgery. I'm not going to be involved in that. It's very important that we be ethical in what we do. And non-maleficence says that first, do no harm is the bedrock of medical ethics. So in everything we do, let us be ethical. The 4th principle demands that we should try to be as fair as possible when offering treatment to patients and allocating scarce medical resources. You should be able to justify your decisions. And this also is very, very important, especially when it has to do with things like organ transplants, cornea transplants. There are so many rules that we need to know beyond academics in giving and in receiving corneas, because they are basically tissue and they should be used in an ethical standard. So ethics, you must be ethical. So teach ophthalmology. It is important to learn ophthalmology. It is not only important to learn, but important to teach. Teach your patients, teach the general public, teach your juniors, teach students, teach fellows, teach residents, teach everyone. You see, what you learn during your residency program, like interestingly, now I go back and I find out my fellowship was 21 years ago. Now, if you keep teaching, you most likely will remain abreast of recent findings. You will remain abreast of the latest in medical literature. If you keep research, you will also remain abreast of the latest literature. And that is the disfavor you do yourself. Sometimes our residents that have left, when I come across them, I ask them, are you writing papers? And some of them, you know, it's so tough. You finish your residency at the age of 40, you don't want to touch anything academics again. But you see, that doesn't do you any good, because you will soon find out, in a short while, you will soon find out that you are 30 years post-fellowship, and you will not believe it. And by then, if you have not been doing research and writing papers, then you will be obsolete. There will be a lot of things that nobody is doing any longer, but you will still be doing it. And it could be an issue of medical legal implications sometimes. So don't let the student in you ever leave. Always continually be a student. Don't let the student in you ever leave. Teach ophthalmology, teach patients, teach the general public. There are many times there are opportunities, we give lectures to the general public, you teach them. And you know, one interesting thing is that they can ask you some questions that those questions really you never really thought about it, and those may be things that will help you to further research. Those may be things that will help you to develop yourself in certain areas. Like, you know, patients ask a lot of questions, and those questions, like a major thing many times, you know, in retina, we're always doing retina detachment, and I talk to patients a lot, and there's always a standing question they ask me: vision after retina surgery. Now, the likelihood is for the retina surgeon to focus on anatomic reattachment. So that has been the subject of a lot of my papers for quite some time. Vision after retina surgery. That's what the patients ask me. When you are trying to explain anatomic reattachment to them, they appreciate it. Well, after you finish your explanation, the next question is, what will I see? Because that is what is important to them. So by teaching and relating with the general public, you are able to assess and reach and get what is important to them. And what is important to them, you now make it important to you. And as such, you become a better person. So teaching actually improves you. We've spoken so much about research. Research is the future. It's the future. Research engagement by clinicians and healthcare organizations improves your healthcare services. Now, research doesn't always have to be things like outer retinal reconstruction or macular hole techniques for huge giant holes. You know, it could be some simple things. It could be you could just be looking at the response of why patients accept a surgery and why they do not accept a surgery. You could be looking at factors that are related to patients. Why do they particularly like to go to surgery? You go to some practices and you see they are fields to the brim, and you come to your own practice, you hardly get patients. It's not all about publicity. It's not all about getting on the social media. There are other things that patients look at that make them go to some places. So you can find out things like that. You can let your research, let it be emphatic, let it emphasize patient-centered clinical research and things that actually improve health outcomes. Preclinical research is important, and it's something I would like a lot to see in sub-Saharan Africa, to see a lot of laboratory work, a lot of biomedical work, a lot of molecular work being done. Sometimes these structures that I need to set this up are very, very rich, are very, very demanding, but we can always start off somewhere. And, research helps us to improve ourselves, helps us to improve what we do. If you keep doing the same thing over and over and over and over and over again for years without analyzing what you are doing, it doesn't show someone who has a very good intellectual reasoning in such things. So challenge yourself every step of the way. Don't get too complacent in doing what you do. Constantly try new things. Learn from other surgeons and even spend a few days in their practice and operating theater, seeing how they go about it. Even when you practice a subspecialty, don't be scared to take on difficult and complicated cases. Now, as you develop in your practice, you begin to know cases that will do well and cases that will not do well. Now, this is not saying that when you see a case that is not doing well, absolutely you take your hands off it. So there are still times you still have to face those challenging cases. It's a little bit like a teacher who only wants to teach the good students, the brilliant students who gets an A+. Those are the only people he wants. But the truth is that if you actually leave that brilliant student alone, he might actually pass without your help. The people that really need your help are those challenged students. And this is our case in medicine. We need to be very, very careful with our patient success selection and patients we intervene in. But it doesn't really mean that we should throw all patients away. Of course, we know no light perception is out of this. But light perception and above, you have to choose, and don't particularly just throw away all cases and say no. Look and evaluate very well and make informed decisions and take up some challenging cases. It helps to improve you. An example I can give again in my specialty is macular holes. When we see in those days, there are some macular holes that they are giant macular holes. They are larger than 1,500 microns, about the size of the optic nerve head, close to it. When we see such holes, in those days, we don't even move near them. We don't bother operating them. But today, we have autologous retinal transplants. We have inverted flaps. Sometimes we even use the anterior lens capsule to do these holes, and we are getting successes. Of course, the successes are not as high as you are doing a macular hole 200 microns in size, but they are better from zero than they used to be. So this has to be informed, risk that we take. And of course, it's very important to learn to counsel patients the right way and have them understand. For us, we have 2 consent forms. We make them sign. We actually allow them to take one home if they want, to be able to read and show the family and let them know that, well, this is a high-risk procedure and the prognosis are quite poor. If they want to, well, we go ahead. Otherwise, they have the decision based on ethics. So sometimes it's good to get out of your comfort zone once in a while. Know your limits. This is important. Think of every patient that you treat as your own family. Under promise and over deliver should be your lifelong mantra. Under promise and over deliver. In the 15th century, the English attributes of an ideal surgeon used to be someone who has the mind of eucalyptus, the eye of an eagle, the heart of a lion, and the hands of a woman. So, you pay attention to details. You are strong in heart. Sometimes they say, oh, why don't surgeons shake especially when we're in accident and trauma? And I tell people that if the patient comes in shaking and the doctor too is shaking, that patient is likely going to die. The doctor has to be thinking straight to be able to save that patient's life. So it's good we have the right approach to our patients, gentle with the patients, have a keen eye, look well, look in between. Every cataract is not the same. The surgical approach to every cataract is different. The surgical approach to every retinal detachment is not the same. You have to learn the intricacies of dealing with giant tears as different from dealing with pseudophakic retinal detachments, the intricacies of dealing with inferior detachments as against superior detachments, the intricacies of dealing with detachments with advanced PVR. All retinal detachments are not the same. Some are quite amenable to scleral buckles, and some will not be amenable to scleral buckles. So have a keen eye, the eye of an eagle. Look in between, pay attention to details. If this patient, if what you can see clinically, like you look at a cataract and it's not so dense and the patient's vision is hand movement, you need to think that there is likely something else apart from the cataract. Don't just jump. That's why many times when they make people only cataract surgeons, non-physicians, that's why they make a lot of errors, because they just see everything at the cataract, treat every nail, because what you know how to use is a hammer, treat every situation as a nail and hit it. So it's important to look, pay attention, look in between. When you have done everything, you have paid attention, you have developed yourself, you have given yourself the best, it is important that you know that when you have done your best, you leave the rest to God. Sometimes, despite your best efforts, outcomes may not be as desired. Take care of your physical and mental health. A lot of doctors do have sleepless nights before and after surgeries, especially if you have a very daunting case before you, or you've done a surgery and there was something that you don't understand that went wrong. Take care of your mental health. Take time to, and I believe that one of the steps is for you to have done your best and for you to know that sometimes, despite your best, outcomes may not be as we want them to. Take time with your family, play your role in your family well, keep your head up, always be optimistic, and things will work out better for you. Thank you everyone for listening. I appreciate you for spending your afternoon or your morning, with us today. God bless you. I will take any questions. Thank you.
Okay, thank you so much, Dr. Oderilo, for the presentation, which was very interesting and impactful, and for sharing your perspectives on how one can develop a career in ophthalmology. I believe we have all benefited from Dr. Oderilo's wealth of experience. And at this point, we'd like to take questions from our participants. If you have any questions, you can type in the chat box, or you can raise your hands. Okay, so one question I have for Dr. Oderilo is, sir, is there a limit to the number of mentors one can have in the ophthalmology field?
Okay, so, well, I think it would be wise not to have too many, in order to be able to spend adequate time with each person, and also because in many cases views differ. So I wouldn't know if there's a specific number for too many. or a specific number for too few. But of course, I think just having the closest, you can have your colleagues who will also serve in sort of an advisory position with you, but the mentors that are closest to you, definitely, even if you're in a department and they have like 12 consultants, I think all the 12 consultants cannot be your mentors. So, I mean, you'll be more, in quotes, natural selection, closer to some who are likely on your pathways. I mean, who are more in the pathway you decide to go. And it's really difficult to set a number and say this number is small, this number is big. It's quite difficult.
Okay, thank you so much, sir. Please, do we have any other question for Dr. Oderilo? Okay, Dr. Arimanma, please, you can ask your question.
Okay, first of all, I want to say thank you very much, Dr. Oderilo, for taking up the challenge to give us this topic. Now, I wish we had more medical students on this phone, because that will also help in their decision as to doing ophthalmology. I don't know if we have any medical students, but one thing I'd like to ask you is what influenced your decision to do ophthalmology?
Okay, well, thank you, Matt, and thank you for the invitation to share my little experience. Dr. Harriman has been in ophthalmology much longer than I have been. But why did I choose ophthalmology? Okay, so first of all, I was looking for a surgical specialty that will not take up all my time. The reason was that I wanted to also have the opportunity to participate in some other things. I knew if I went into something like neurosurgery or cardiothoracic, then it's likely that my family will not see me at all. So I wanted a specialty that was surgical. I wanted a specialty that I could actually, now this is the funny part. I wanted a specialty that I could master in a short while. So then I would tell myself, I'm going to that small eye. In 3 years, I will finish everything. I will master every detail. I will read. Until I started and I found out that, wow, it may be a small eye, but there's a lot in it. So yes, I wanted a specialty that was surgical, something that will be engaging but not consuming, not fully consuming but engaging, because I also wanted to have family time, and I will also say I wanted to have church time, and I also, I'm also involved in a number of other things that I do, that I didn't want something that will be 100% consuming. That's the truth. It's been a balancing game all through, but I think I still prefer to play it the way I have played it. That was my choice for ophthalmology.
Thank you.
Thank you.
Okay, thank you, sir. We have another hand raised up, Dr. Ajayi Obe. Please, you can ask your question.
Okay. Good afternoon, or is it morning? Now?
Good morning.
Thank you for this brilliant lecture. I'm a consultant pediatrician. I work at the Hammersmith Hospital in London, and I'm actually on a sabbatical at the moment. The big issue about the brain drain is what I'm trying to see how we can address. I believe that this is a brilliant lecture, but what are we going to do about the young ones, and what are your plans in helping carve out their careers in such a way as it actually meets their needs? I believe that your institute is doing brilliantly well, but I think we need to continue to foster ways in which we can actually benefit on the two way, in both ways. These young ones, most of them will plan to go abroad. And I'm sure you're feeling the effects of it. I believe that your institution is in a position to actually help, carve it out. You have links with abroad. Obviously, you went to Glasgow, and the others have traveled abroad for fellowships. Going abroad is not actually 100%. I mean, it has its pluses and has its negatives. You're a family man, you've enjoyed your family. These young ones also want to enjoy their families as well and see their children progress. There are big issues abroad as well, the issues here as well. How do we develop a way of which we can benefit both ways? Perhaps you start the program here, you find a way of them going there and also coming back, or having an opportunity to come back. So developing those programs. I see your program was mixed. Looking at your CV or your biography, you can see it was mixed. It was a mix between your institution. You went to LABC, you went to Lorry, you went to other places. Can we do that also with going abroad as well, where we can create those opportunities when they can actually go abroad, they can learn, also make some money, at the same time come back? So that's my question.
Okay, thank you very much. It's a present challenge in Nigeria. In the past, I would say 2-3 years, it's really been difficult. We have a residency training, and initially when we started the residency training, I was one of the first sets, and we had a International Council of Ophthalmology exams. Then we went to Glasgow for clinical attachments, and then we did the Edinburgh exams. And after passing, we came back to do the subspecialty. So yeah, our own training had been a mix. So in the institution presently now, we are accredited by the West African and the National Postgraduate College. So the trainings we are doing are basically around the curriculum of those two colleges, although we still do the ICO. And so I think one of the main challenge, like, we cannot separate the ophthalmology training, we cannot separate ourselves from what's going on in the society. There's a lot going on. There's inflation. People want to earn more money, even when you see, we've come to the conclusion that in terms of finance, it's going to be difficult for any institution here to pay as much as the Americans or the British or the foreigners will pay. So by and by, there's still likely going to be some people going there because of finance. But what we can do, I believe, is to reduce it to the minimum. But everything still centers around developing good institutions. If we have good institutions that help people to track their career and they can see themselves moving ahead, you do your residency, you come into the practice, you subspecialize, you join a group practice, you get some stake into the practice, you develop yourself, you develop others. It helps people. I think it helps people to be, once they can see a pathway for themselves to grow. And I think in our own little corner, that's what we can do. But we need all hands to be on deck. Everyone has to be working together, not in silos, not just having a small practice. Let's all develop strong institutions where we can bring the younger ones in and they see a pathway of growth, a way where they come in early, they can develop themselves skill-wise, they can improve themselves. Now, a few years ago, the government actually had this program where, as a senior registrar, you travel abroad and you get subspecialty or you get specialty training and you come back. Really, what, in my own opinion, what kills that was a lot of people go and they don't come back. Many reasons that they don't come back. I try to mention some of them. Somebody gets trained, let me use my specialty as a retinal surgeon, and then you come back, you don't have anything, you don't even have a laser, you don't have a cryo, you don't have a good microscope that can do posterior segments, you don't have the things that you need, you don't have a vitrectomy machine, you don't have anything. Now, if you go and train to be a retinal surgeon and you come back and you have nothing to work with, we all know that in about 3 or 4 years, if it takes that long, you really need to be retrained again to be able to do many of the delicate cases. So those are the challenges in the society, but I think each of us in our small areas can work on it, develop strong institutions, work together so we can get equipment, help to train people. We still do in our institution, despite the challenges, we still do give opportunities for exposure to other practices and other clients. Well, we take the risk. We take the risk, but I think it's something that all hands have to be on deck. And also, there's a strong place for the society, I mean the ophthalmology society, to play. There's a strong place for individuals to play. There's a strong place for the governments too, to be able to make things available. If we all live, we are all living to places where they've developed well. I think that some people just have to make the sacrifice and hope for the best. If you do, maybe you also do have some ideas you can share with us.
I think for me, personally, I think not everything is green on. I think you have to create a balance. Nigeria has its problems, abroad has its problems as well. I personally think that we need to take the best, provide these young ones with the best. The start of their program, just like you had a brilliant residency program. At the end of the day, if you give them that opportunity to go out there, most of them will actually, too many of them, even when they go out there. Yes, there's some people that break the ceiling and get the consulting jobs and do the surgical skills, but not many of them don't actually get to do it. So they start off having these aspirations, wanting to be an ophthalmologist, a surgical ophthalmologist, and get on. But when they go abroad, most of them will end up not doing the surgery. But it's a good idea for them to actually go and get that experience, make the money they want to make. But create the opportunity, give them a program which they can actually come back to, you understand, come back into the system. So at least if you have a certain number of years for them, that gives them the training, but doesn't cut them off completely from the program. Most of them are coming back, but even actually planning that, even if they're going to go for those couple of years, give them the ability to plan, you understand, so that they can get the maximum amount in terms of money, finances, savings, and all the rest, so they can come back to something like a rolling program. And you can have them, you can have that program, you can have another program run just to straight through in terms of the Nigerian program, but just being a bit more innovative. So we're not losing these people. And they too always feel they're coming back to something, they know they can come back to something. Just for me. So you have many people, instead of them saying, oh, I'm going to go and do ophthalmology in England, and they don't even start the program, they're not going to get it. It's very difficult to get the surgical. And we should be doing the research as to what is happening to those ones outside. Some of them I have lots of colleagues who are doing very well in ophthalmology, but there are quite a number of them that try to do it and have not succeeded. And give these kids the facts. That's just me. Sorry. I hope it's useful, but I'm just creating those challenges. I feel that we all have aspirations as young people. They have aspirations. They want to become ophthalmologists. The chance of becoming ophthalmologists in Nigeria is probably higher than out there.
Yeah.
But at the same time, they want to look after their families, and they want to see what's out there. Even going on conferences is expensive.
Yeah.
So just
with the new exchange rate, it's killing.
Yes. That's just my opinion. It's just an option.
Okay.
To explore.
Thank you so much.
Okay, thank you very much, Dr. Darinlo and Dr. Darajayi, for those insightful responses. So at this point, I would like to take some comments. A comment from Jemmy Adomi says, thank you for this enlightening conversation. I think that's what he or she wants to. Okay, how do you balance your roles as a researcher, a clinician, a surgeon, and a family man? A question for you, sir. Yeah.
Okay, well, I think it's something. The best thing is to start early, and I would say that right from your residency, you get into research, so you are used to doing everything together. So research involves, you don't start research when you pick up your biro. You start research every day. Every day you see a patient, you have a question. I have notes that I take. Right now I do that on my phone, and a patient comes in and he sees something, I see something important, and I want to ask myself, why is this like that? Why is this like that? That's a research question. So I think it's best to start early, start picking up interest in so many things, and for me, most of my interest comes from my daily clinic. So yesterday I was looking at some patients, and some of the patients that came in, they had very good vision. They all had retinal surgery, and some didn't have good vision. So I was looking at the factors, and just right there and then I wrote out a study that I was going to do. So I think every day is research. Every day you go to clinic, you open your mind, patients ask questions, you notice some things. I mean, you see some patients doing well, some not doing well. You ask yourself, you take notes, and then you sit down on your notes and you develop topics around the notes. Then you go, that for me, that's step one. Then step two, you go and study literature, and you'll be surprised that your question, you will have seen a lot of people trying to address it. And then you can see what is already known, and that will help you to now write out a topic and start the research. It's what you should take every day. Research and clinical work should be part of you. You should not separate it and say, okay, this is this. It should be part of you. It should be things that you take along with you every day. And as you go in clinic, you ask questions. And of course, as a family man, you need to pay attention, I mean, to the needs at home. You need, like I just came back, I think 2 days ago, from going to see my children. So you spend time to be with them, to hang around them, to go. I was opportune to go to his school, actually sleep on his bed, and have time together to talk and discuss. And so I think the best way is to take everything together. Take everything together. Avoid taking, let me classify it very well. Avoid taking too much work back home. So that, because when you leave work, home is also work. You have to help your children with their assignments, because if you are not there, they don't, later on in life, when they are discussing about challenges they had and how they got through, they don't remember you because you were not a part of it. So you have to be a part of it my suggestion is to plan your time well and take everything together. Don't dump family because of, that's my own opinion, because of profession. And you cannot dump profession, because that's where you get your own satisfaction, your own you get your own fulfillment, and also you make a living, because even the children we talk about, you have to pay for them to go to school. So those I think that my suggestion would be, take everything together, plan your time well, give adequate time to each one as the demand requires. Try not to push one too far and leaving the other behind. That's my suggestion.
All right. Thank you, sir, for that. Another comment says a very impactful lecture that has very wide application. I'm a family physician who had at a time dreamed of being ophthalmologist. Well, I wouldn't know if this person wants to ask a question or not.
Yes. Good day, Dr. Oderinlo. Thank you very much. Yes, for your amazing, should I say, seminar and talk. I'm a medical student. I mean, Dr. Ayo mentioned it would be very helpful for medical students to, get a few insight into how to proceed into the ophthalmology field. And I was I was drawn to also the comments or the response Dr. Dio also mentioned about, the challenges, should I say, junior doctors going into the field of ophthalmology might face, when they eventually want to consider. I know you said you were drawn into ophthalmology, due to the fact that you wanted, in quotes, a specialty you could master in a short while. But also it was a surgical specialty, and it's engaging and not, completely time consuming. But what are the challenges you had to face? I think you were also you're a fellow in the you gained your diploma, ophthalmology diploma in the Royal College of Ophthalmologists in London. So, getting to all these stages, and also, being the West African College of Surgeons, being a fellow there as well. What are the challenges, or should I say, checkpoints you had to face, whereby, or did you face any challenges, or should I say situations whereby you doubted, continuing in ophthalmology? I know you said obviously ophthalmology you initially seemed more or less an easy career to, to go into, as opposed to any other specialty. So what are the challenges you kind of faced, or do you think, or advices you would give for, aspiring junior doctors going into ophthalmology? Does that make sense?
Yeah, makes a lot of sense. Thank you. So I think the first shock that I received in ophthalmology when I stepped in was to realize that it's really quite extensive. In med school, we just did 2 weeks in ophthalmology, and in our final year, they asked us we had 2 weeks free that we could go back to any specialty we felt we were not exposed to. Interestingly, I went back to ophthalmology to do another 2 weeks. And so after having done that, I thought I had an idea of what ophthalmology was, but I was absolutely wrong. When I came into ophthalmology, the first shocker I got was that it was extensive. And we started optics. Optics was not on my table. I didn't think about it. And so anatomy, yes, I was expecting that. And towards the primaries, it was tough. So I think the first thing you have to do when you step into ophthalmology is step up. Because most of the time, what you think ophthalmology is as a medical student is not exactly what it is. It's quite wide. It's quite wide and quite engaging. However, getting into it, I found that I liked especially the surgical exposure. The fact cataract surgery was a mind blower for me. I get so fulfilled when you're able to do a procedure for 10. I see people, they hold their hands, they walk in, you do a 10-15 minutes procedure for them, they're on their feet, they see you the next day. You know, I've had patients hug me. I've had patients say, wow, I didn't know you were so young. That was before all the white hair started growing. And and so it was because they didn't even see who they were talking to until after the surgery. So the fulfillment on their face was a game changer for me. And that helped me to keep my focus on it. So I think the first thing you get if you come into ophthalmology is you realize that it's really wider than you thought it was. But that shouldn't be discouraging, because it's something that you just need to step up your time. The same way you've met with the challenges of med school, you had to do extra time, do extra work, pay more attention, know yourself, know how you learn. Like I am quite visual, and so when I read a lot, I listen to seminars. I'm one of people that's so happy now that there are many webinars and so on, because I'm visual. I really like them. I listen to them, go back and study. And those things really help you to build up. So yeah, it's going to be more challenging, but you just need to step up. That's just step up dedication, step up time planning. Let go of a number of irrelevant things. Like, you know, in Nigeria, people go for parties and we call them Owambe in my own part. You hardly see me. I mean, you have to be very close to me for me to show up. It's not that I don't like rejoicing with people, I do, but my time is pretty much structured in order to be able to meet with things that I consider are more important for me to do. So I hope I help, and please feel free to reach out anytime. I'll be glad to offer any other advice I can.
Okay, thank you,
Thank you,
Dr. Odenrilo. Okay, Eleon Toby. Okay. Dr. Dayo Ajayi, your hand is still raised. Do you still have any question? Okay. Do you have any other question? All right, if we don't have any other question, Dr. Odenrilo, thank you so much for your time and the effort you have put into this presentation. I'm sure both the young and experienced ophthalmologists have benefited from today's lecture. We thank you so much, sir. And we wish you all the best in the next steps you are taking in your career.
Thank you.
Thank you, sir.